Hey guys, I'm going to walk you through dry needling because it's one of the more common soft tissue treatments that we use at Elevation, and we tend to get really good results with it. So the idea of dry needling is that you are taking a sterile needle and you are placing it directly into an irritated or injured soft tissue in order to decrease symptoms or promote tissue healing. One of the main pieces that I like to focus on is the blood circulation aspect. When you take the needle and you place it into the tissue, it creates what we call controlled microtrauma. That controlled microtrauma results in increased blood circulation or potentially even some bleeding in that area, and allows those soft tissues to then get the nutrients that they need in order to heal effectively and appropriately. And so this can be really helpful in certain areas of the body, such as in tendons, if you've got a tendinitis or a tenosynovitis going on, where the tendon may not have the best blood supply. You take the needle and you create a ton of microtrauma in it. The idea is that theoretically, we can create a lot more blood circulation and allow that tendon to recover much more rapidly. So when we're performing dry needling, we can do this in so many different areas of the body and for so many different conditions. We've got a laundry list of conditions that we treat at Elevation on our website, but common areas are in the shoulder, the low back, neck, even for headaches or upper and lower extremities as well. So across the board, we can be really helpful with dry needling. With dry needling, we tend to use several different techniques. And so with that, we have two different sizes of needles that we tend to use in the office, depending on what the tissue is that we're treating and how deep we need the needle to go. And one of the techniques that we use is where we take the needle and we place it directly into the tissue and we leave it. So once again, it helps to increase that blood circulation to the area. Another thing that we can do is put multiple needles in the area and leave them and attach a stim unit. So this is the stim unit that I use in the office, and it comes with these little jumper style cables that you can attach to the needles, and it creates an electrical signal that goes between the tips of the needles. And so this can be helpful with reducing swelling, reducing soreness and pain, or even helping to fatigue the muscle by creating a bunch of different muscle contractions at different rates with how strong the muscle contractions are or how fast those muscles are contracting. Another technique that I like to utilize in the office, or that we use pretty often, is a pistoning style technique, which is where you take the needle and you place it into the tissue, but you fan it in all different directions around it to create as much controlled microtrauma as you want in that area, and then you pull it out. So the idea with more controlled microtrauma, you potentially can increase more blood circulation to the area theoretically to help it heal that much more quickly. A lot of times in these areas though, we have what we call myofascial trigger points, which are almost like a little knot within a tight band of irritated muscle tissue. And it is the body's natural protective mechanism to develop some of these myofascial trigger points depending on what type of activities we're participating in or what is potentially going on in a certain area, and they can help to reduce some of the stress to that area. The problem with them is that they tend to be large pain generators as well. So they can be generating a lot of pain around the irritated area, and if you don't necessarily address those, sometimes the symptoms don't fully go away. So what happens when you start pistoning around some of these areas and you hit a trigger point, it can create an involuntary muscle twitch or contraction. That tends to be a little bit shocking or alarming for most patients, and it's not the most comfortable, but typically you know when that happens, you're in a pretty good spot. And personally, I will piston through that trigger point, sometimes until it stops twitching, or allow it to twitch a few more times and then immediately pull it out. So those are the main types of techniques that we use, and we can go through several needles or really only one needle, depending on what is being done in what area and kind of how the patient is presenting. I'm going to walk you through these techniques and do a demo of them in this video soon to come, and you'll see the pistoning style while I'm also leaving in some needles in the low back and then attaching the stim unit to it to create some muscle contractions. If you've got any questions at all about these, do not hesitate to get in touch with us or take a look at our website.